on stopping a small bleed. The first thing you need to do is check the scene for safety. The second thing you need to do is get permission from the patient to treat them. May I treat your arm?
Yes.
Alright, the first thing I need to do is make sure that I'm safe. First, apply a small gauze strip to the cut. I'm going to have you hold this, okay? Alright, can you raise your arm? The next thing I'm going to do is wrap a gauze bandage around the wound, nice and firm.
Our next procedure is how to treat a large bleed. First, you check the scene for safety. Then you have someone call 911. Call 911! Then you get permission to treat them. Is it okay if I treat your leg?
Yes, please.
Take a towel or a large cloth and put it over the injured area. Have them hold it for pressure. Then tighten, strap above and below the injured area. And then you wait for 911. That's how you treat a large bleed. Our next skill is how to treat an infant who is choking.
Help, my baby's choking!
Do you need me to help? I'm certified in CPR.
Yes, please.
Have someone call 911. Call 911! First, pick up the baby and place it on your forearm, supporting the neck with your hand. Sandwiching it with the other arm, flip it over so it's face down. Using your thigh for support, deliver 5 back blows. Flipping it back over, deliver 5 chest thrusts. Repeat this cycle until paramedics arrive or the entire object is out. This is how you treat an infant who is choking.
Our next skill is how to treat a conscious choking adult. The first thing you do when treating a choking adult is check the scene for safety. The next thing you do is have somebody call 911. Call 911! The next thing you need to do is get their permission. I'm CPR certified. Can I treat you? Alright, the first thing you do when treating the adult is to bend them over slightly and give them 5 blows in between the shoulder blades. The next thing you do is stand them up, cup your fist in your hand, and give them 5 thrusts just above the navel. You continue this cycle until either the item is dislodged, the person becomes unconscious, or the person can forcefully breathe or cough. If the person becomes unconscious, you need to call 911. And that is how you treat a conscious choking adult.
This is how you treat a patient with allergic reaction. Hi, my name's Anna. I'm certified in CPR. Are you having an allergic reaction? May I help? Do you have an EpiPen?
Yeah, it's in my bag.
Make sure it's theirs. Check the expiration date. Have you already administered it? Do you want me to do it for you?
Yeah.
Take off the lid and push it into the thigh until it clicks. Hold it for 10 seconds. And then rub. That's how you administer an EpiPen.
Our next skill is the procedure of applying a sling to a patient with a dislocated shoulder. The first thing you do is check the scene. The next thing you do is get the patient's permission to treat. Can I treat your shoulder?
Yes.
Alright. The next thing you do is get a triangle bandage and put it over the injured arm. Next thing you do is have them move their arm, so you put it under. You then bring the injured arm up with the bandage, as long as it's not too painful. Then you tie it in a knot behind them, and then wait until they seek further medical attention. And this is how you apply a sling to a patient with an injured shoulder.
Procedure is how to treat a patient with a simple fracture. First, check the scene. If it's serious enough, call 911. Then ask the patient for permission to treat them. May I treat you?
Yes.
Then make sure that you're safe. Grab a large towel or cloth and wrap around the ankle so it is immovable. Then take a strap and tie it and that is how you treat a simple fracture. Compound fracture where the bone is sticking out of the skin. First, check the scene for safety. Then call 911. Call 911. Then ask the patient for permission to treat. May I treat you?
Yes.
Say the injury is right here. You want to put 2 straps above it and below.
Our next skill is the procedure of using an AED on an unconscious patient who is not breathing. The first thing you do when you come across an unconscious patient is check the scene for safety. The next thing you do is call 911. Call 911. Then you check the person for visible injuries or bleeding. After all those steps, if an AED is available, you need to use it, and if not, you apply CPR until one arrives. The first thing you do when using an AED is remove the clothing that covers the chest of the patient. Next, you follow the instructions on the AED. The first thing you do is you plug in the pads to the machine. You take off the paper covering the pads and you put one pad above the breastbone on the right side of the patient. You put the next pad below the breastbone on the left side of the patient and wait for the AED to analyze the patient's vitals. When instructed, either apply a shock or do not apply a shock. And after you apply the shock, wait while the AED reads the vitals again, and if directed, apply another shock or do not apply another shock. If you're instructed not to apply another shock, then just remove the AED and wait for emergency responders to arrive. And if instructed to give another shock, just follow the instructions. That is how you use an AED on an unconscious patient who is not breathing. Patient with a neck injury away from a dangerous situation, such as if they were flung from a car in an accident and are laying next to some gasoline or another burning car. The first thing you do is check the scene for your own safety to make sure there is no immediate threat. The next thing you do is make sure somebody calls 911. Call 911. Dealing with a patient that has a neck injury is a very serious situation. You want to make sure you're very careful with their neck, and the first thing you need to do is stabilize their head with your arms when you drag them. The first thing you do is make sure that their arms are on their abdomen. You reach under and get their head positioned in between your arms and grab their clothing and pull.